Hi, my name is Jackson. I'm a student physical therapist at Rocky Mountain University, and today I'm going to be demonstrating lung auscultation, airway clearance techniques, and a breathing technique. And this is our patient, Steven. You doing okay, Steven?
Yeah, I'm doing well, thank you.
Okay. So we're going to start with the lung auscultation, and for this, I need to have the diaphragm of the stethoscope on bare skin. Are you okay with taking your shirt off?
Yeah.
Alright, so we're going to listen to the front and the back of your trunk, basically. And we're looking for normal lung sounds, which are described as like a breeze going through the leaves on a tree. Other possibilities are diminished sounds or adventitious sounds, which would just be any extra sounds you wouldn't normally expect. So I'm going to start with your back, and I'm going to be placing the stethoscope at the top of your back and then moving down in an S-shaped pattern until I get to the bottom of your lungs, until I can't hear anything anymore.
Okay.
And during this, I want you to just breathe normally, but I'll have you be breathing through your mouth.
Okay.
Alright, that all sounded good and normal. And also for listening on the back, the one thing that's different from listening in the front is you want to avoid putting the stethoscope over the scapula because the bones can block the sound from being transmitted. And we'll do the front of the chest now. Breathe in. Alright, and all those sounds were normal as well. Before we start the airway clearance technique, I want to teach you what's called a huff cough. So it's different than a normal K-sounding cough that we usually do. It's less harsh, should reduce any pain that you feel with coughing, and just make it easier on your lungs and throat. So what you're going to do is put your mouth in kind of a O position. Think about trying to fog up a mirror, and then you're going to forcefully exhale in that position, just like this.
Okay.
So go ahead and give that a try. Good. Okay, we'll move on. So the airway clearance technique we're doing is called autogenic drainage. The main benefits of this specific technique are to improve breath control and to mobilize secretions so they can be expelled. And there's 3 phases of this. So first, we're going to have you just sit with your neck slightly extended, and then we'll have you huff cough right now before we start, just to get anything out that's currently in there. Okay, and then the first phase is called unsticking. So I'm just going to talk you through this, so just listen to the instructions as I give them to you, and yeah, I'll tell you what to do.
Okay.
So to start, just take some normal breaths in and out, focusing on control of that breathing. And then I want you to take in a very deep breath and then blow all of the air out on your exhale. Now take in a small breath through your nose. Hold that for 3 seconds. 1, 2, 3, and exhale everything out. And inhale again, small through your nose. hold for 3 seconds, exhale everything out, and one more small inhale through your nose, hold for 3, and blow everything out. Alright, now phase 2 is taking a normal sized breath and hold for 3 seconds. And with just some gentle force, exhale everything out of your lungs. And try not to cough yet. And then another normal breath in, hold for 3, and then exhale everything out. And we'll do that one more time. And exhale everything out. Okay, now taking a really deep breath. Hold that for 3 seconds. And gently expel all the air out of your chest. And even bigger breath this time. In. Hold for 3. And blow everything out. And now we're going to do the biggest breath that you can get in. Hold, and then after you fully exhale this time, I want you to huff cough at the end. Nice, very well done. Okay, and then the breathing technique we're going to be doing is diaphragmatic breathing. So the purpose of diaphragmatic breathing is to decrease the work of breathing, decrease respiratory rate, reduce stress, and also it helps people learn not to use their accessory muscles as much in their chest and like upper back. So for this technique, we're going to have you put one hand on your chest, one hand on your stomach, and then you're going to be breathing in through your nose, holding for 2 seconds, and then breathing out through your mouth for 4 seconds. And on the inhale, I want you to focus on pushing your stomach and abdomen out in all directions and not letting the hand on your chest move. So let's go in, 2, 1, 2, hold for, or just blow out for 4. 1, 2, 3, 4. In for 2, out for 4. In for 2, out for 4. Alright, good job.